Today the topic of my discussion is the clinical spectrum of associated autoimmune condition in type 1 diabetes in developing countries. The background is that type 1 diabetes is a condition of chronic hyperglycemia due to autoimmune destruction of pancreatic cells, and it is associated with many other autoimmune conditions, with hypothyroidism being the most common, and it is followed by celiac disease. And the objective of this study is there are two objectives. First is to determine the incidence of different autoimmune conditions in children and adolescents with type 1 diabetes in developing countries. And the second one is to determine the clinical pattern of autoimmune conditions in families of children and adolescents with type 1 diabetes in developing countries. The methodology is it is a prospective cross-sectional study of 6-month duration, and it is an ongoing project, and it will be conducted in the Department of Pediatric Endocrinology, the Children's Hospital, Lahore. The inclusion criteria for the patients are children with age 1 to 18 years, and those having type 1 diabetes mellitus would be included in the study. The exclusion criteria are age less than 1 year and age more than 18 years. Type 2 diabetes, monogenic diabetes like Moody and neonatal diabetes will be excluded from the study. Secondary diabetes like cystic fibrosis related diabetes, thalassemia related diabetes, and syndromic diabetes would be excluded from the study. There are the few results which I want to share with you. So far we have data of 47 cases. Out of them 22 were males and 25 were females. The mean age of diagnosis of type 1 diabetes was 6.3 years, and the mean duration of type 1 diabetes for the patient was 1.8 years. The consanguinity was positive in 21 cases, and other autoimmune conditions were present in 6 cases, and family history of autoimmune condition was positive in 18 cases. This is the graphical presentation. Celiac disease was the most common among autoimmune condition in children with type 1, with the percentage of 12.76%, hypothyroidism with a percentage of 2.13%, and autoimmune hepatitis with a percentage of 2.13%. This is the frequency of different autoimmune conditions in the whole family, and type 1 diabetes was most common with a frequency of 17.02%. Celiac disease was 8.51%. Hypothyroidism was 8.51%, and vitiligo 4.26%. Hyperthyroidism 2.13%. Nephrotic syndrome was 2.13%, and rheumatoid arthritis was 2.13%. This table is showing frequencies of autoimmunity in different family members. In siblings, 7 cases were having autoimmune conditions. Type 1 was in 4, celiac was in 2 patients, and nephrotic syndrome was in 1 patient. The mothers of the patients, 7 cases were having autoimmune conditions. Type 1 was in 5, hyperthyroidism in 1, hypothyroidism and vitiligo in 1 case. In fathers, 4 cases were having autoimmune conditions. Type 1 was in 2, hypothyroidism in 1, vitiligo in 1. And in extended family members, 9 cases were having autoimmune conditions. Out of them, celiac was 3, vitiligo 1, type 1 diabetes was 1, hypothyroidism or Hashimoto thyroiditis was 1. On maternal side, 3 cases were having hypothyroidism 2, and rheumatoid arthritis 1 case. The limitation of the project is that so far limited data is available, and it is an ongoing project. And coming to the conclusion, children with type 1 diabetes in developing countries seem to have 12.8% incidence of other autoimmune disease, with celiac disease being the most common. Autoimmune condition in family were found in 38.3%, with type 1 diabetes being the most common conclusion. Thank you very much.